I am Stephanie Kaufman with AmeriCares, and it is a great honor and privilege to be having a conversation around medicine security. Medicine security means that every clinic, every health worker, and every patient, everyone around the world would have reliable, equitable access to the medicine and supplies they need to achieve good health. But to achieve medicine security, AmeriCares believes communities need medicine accessibility, availability, affordability, and acceptability. Communities without any of these four components can be medicine insecure. But more commonly, these pieces interact, and often they are underscored by individual poverty. Nearly 2 billion people have no access to basic medicines. That means quality essential medicines are unavailable, unaffordable, inaccessible, or unacceptable for a quarter of the global population. Today, we will be discussing bringing equity to medicine access. So let's meet our panel. Joining us today is AmeriCare's Chief Medical Officer, Dr. Julie Varghese. As Chief Medical Officer and Vice President of AmeriCare's Technical Unit, Julie supports AmeriCare's work to increase access to quality medicine for low income and uninsured patients worldwide. Welcome, Dr. Varghese. Next
Thanks,
up,
Stephanie.
joining us from Pfizer is Julie Jensen, who is the Director of International Product Donations as part of Pfizer Global Health and Patient Access. Julie leads Pfizer's strategy for international medicine and vaccine donations, including investments in global health delivery. Julie is also responsible for Pfizer's flagship donation programs and the company's response to humanitarian emergencies. Welcome, Julie. And also joining us from Ghana is Samuel Akufo, Ghana Country Operations Lead at Zipline, an innovative company who is shipping medicines and supplies through autonomous aircraft delivery. Samuel leads the health and fulfillment teams across all Zipline distribution centers in Ghana. He provides direction and guidance in operation excellence, stakeholder management, customer experience, and people management. Welcome, Samuel. So, what I'd like to do to kick off this conversation is at the onset of what I mentioned was I've given you AmeriCare's definition of medicine security, but I would welcome the opportunity to hear from you as to what medicine security means to you and why is it so important now. So, why don't we kick off the conversation with Dr. Varghese? Over to you.
Thanks, Stephanie. I would say that I view medicine security from a few different perspectives. As a physician, I've been really fortunate to have the opportunity to care for people in a variety of contexts. So here in the US, I've been a part of the free clinic sector, the federally qualified health centers. And just prior to joining AmeriCares, I was actually in a private practice medical group in Connecticut. And, at least a couple times a week in my private practice group, I was having conversations with my patients about how they weren't able to afford their medications or not able to take them the way it was being recommended or prescribed. And so, when I think about being here practicing medicine in Fairfield County, one of the most affluent counties, in the US, and also with a high health literacy rate, that really reiterates the issue around medicine security, here in the US, and we've heard a lot about that throughout the other sessions. Similarly, I've been able to work in other under-resourced settings like India or in rural Haiti. And in addition to that affordability piece, there's so many factors around accessibility or ongoing availability. And so when I think about, practicing medicine here in my own backyard, so to speak, and halfway around the world, that same core issue around medicine security or lack of medicine security really is so central to patients' ability to be healthy or my own ability to provide quality care. When I think about medicine security on a broader level and health being so fundamental to everything that an individual needs to be healthy, to live a productive life and contribute to their community, I really don't think that you can separate medicine security from health as a human right or from health equity. Similarly, we heard in the earlier sessions, you can't really separate clinical health from social health. And so I think that medicine security really underpins so many of these broader topics. In terms of how AmeriCares got to this work around medicine security, we've been delivering medications for over 40 years to our healthcare partners around the world. But there's so much beyond just the availability of medicines and getting medicines to the countries where we work. There's broader health systems factors that our health center partners are dealing with every day, and that their communities are dealing with, whether that's transportation or health literacy, health centers with staff shortages. And so we wanted to find a way to really reflect all of those different factors that affect one's ability to be healthy and access those medicines. And so we've done a lot of strategic work, both with internal stakeholders and some key external stakeholders, and really found that medicine security was that overarching concept that helped to bring all of those different factors together.
Great. Thank you, Dr. Varghese. I'm now going to pass it over to you, Julie. I'd love to get your perspective in terms of what medicine security means to you, and particularly in the context of the work that you do at Pfizer.
Well, first, thank you so much, Stephanie, for inviting me to join this panel. And thank you to AmeriCares. Pfizer is a long-term, very proud supporter of AmeriCares. So it's great to see you convening such an incredible gathering on health equity. So on medicine security, I have to be honest, this is not really a term that I've used regularly. Normally, within our context, we talk about access to medicines, we talk about health system strengthening. But as I was thinking about this term, I really like it because some of those other terminologies can be a bit vague. And this is very much laser focused on what do we need to do to get this treatment to a patient. It's really, we talk about following the pill. And as Dr. Varghese was saying, what are all of those things that need to be in place in order for that to happen? And so as part of my role at Pfizer, I sit on the patient access and social impact team. And first, of course, we're thinking about access to medicine. We're thinking about affordability. We're thinking about the piece that we spend all of our days at Pfizer thinking about. But then there's the other investments that need to be made. So our team is responsible for how do we deploy our people and our resources, our technical resources, to help strengthen, in this case, that secure supply chain for medicines. How do we deploy our capital, our investments to help build those health systems? And then, of course, how do we make the medicine available? So I think the medicine security term is really interesting. And I think as we talk about it today, just understanding all of the things that have to be in place for equitable access and distribution to medicines. Thank you.
Great. Thanks. And now, Samuel, would love to get your perspective through the work that you're doing with Zipline and just the work that you do in Ghana.
Yes, thank you, Stephanie. To me, medicine security exists when clients can obtain and use essential health commodities when and where they need them. And the two key words in here is when and where they need them. And this tends to strongly throw more emphasis on not just access, but also reliability and the criticality of supply, which is directly linked to what we do at Zipline, which is making sure that every single human has instant access to medications when exactly they need them. With respect to reliability, when a population receives medicines intermittently and there isn't any guarantee of the next period of availability, it raises issues of supply reliability, and ultimately then the term medicine insecurity comes in. And for patients living with chronic conditions who need these critical medications to survive, it becomes a major blocker for them to achieve their health outcomes. When you're talking about the issue of criticality, which is to me the where, in a case where medicine is needed critically during an emergency or a life-threatening situation, the only time and place it is really needed is that particular moment and location where it is critical, and it may be available at another location where it may have no clear immediate use, but not being able to have it where you need it the most raises issues of medical insecurity. And this concept also to me is directly linked to access and equity in a very clear way. Access which has to do with people within their reasonable means being able to get medicines they need to achieve their health outcomes, and equity being an issue of fairness. Health systems generally must dig deeper to take into cognizance the differences we have in populations and patient requirements, locations. You have people living in rural areas and urban areas. Physical access to could also be a problem, and some of the other key indicators that would help us be able to achieve universal access needs to generally be looked at, and all that plays a role when they're talking about medicine insecurity. Actually, WHO in the past came up with what we call the EML, which is the Emergency Medicines List, some years ago, which looks holistically at policy, quality, access, and rational use. I think it is even more pertinent now that we are in a pandemic, when global supply chains have been interrupted and is not as reliable and movement is restricted. Medicine access could definitely be affected. Again, with a shift in focus to COVID-19 vaccinations and the need to vaccinate populations around the world, we need to get more creative around how we can still ensure there's available resources, and the available resources we have are not really stretched thin, to affect medicine security.
That's great. Well, we're definitely going to be talking about global supply chain issues a little later on in our conversation today. But I don't think that we can be having a conversation about medicine security without having a conversation around vaccine equity. And so we know that safe and effective COVID-19 vaccines were developed in record time. These vaccines really do offer us as a global community the best hope for slowing the coronavirus pandemic and, of course, saving lives. But the virus is moving faster than the global distribution of vaccines. The majority of COVID vaccines have been administered in high and upper income countries around the world. But as new variants of concern start to continue to be out there, it means that the risks of infection have increased for people who have not yet been protected by vaccination. So the World Health Organization has a goal of vaccinating at least 70% of the population, the global population, by mid 2022. But how are we going to get there when there's so many challenges in terms of that vaccine distribution process? So I want to give this one, start this off to you, Julie. How do we get there in terms of trying to meet that 70%, WHO benchmark? And then how do we think about the equitable distribution of COVID-19 vaccines?
Great. Well, thank you. So back in March 2020, our CEO told us that we need to make the impossible possible. And we have been striving to do so at Pfizer ever since. And one of the main North Stars that we've had since that time was equity, which in our minds is the right to be seen, heard, and cared for. So that continues to drive us. And I think you've seen, we've made the commitment to supply 1 billion doses of our vaccine to the US government for donation in low and lower middle income countries this year, and another 1 billion next year. And our manufacturing colleagues are working round the clock to make that happen. Not just for those countries, for all countries. And so I think, beyond that, we can have vaccines, but that doesn't equal vaccinations. So in addition to making the vaccine available, we also have to have the right partnerships enable for distributions to happen within countries. So we continue to partner with the global health community, with organizations, with NGOs, with partners who are actually helping distribution, to ensure that the vaccines that are available are distributed equitably throughout the world. And those conversations continue and actually really push us to, again, ensure that we can meet the goals that were set.
That's great. Thank you. Samuel, over to you. Zipline has successfully distributed tens of thousands of COVID-19 vaccines supplied by COVAX throughout Ghana. Can you elaborate on how your team has been able to create these opportunities for vaccination in Ghana? And what key lessons have you learned that others may want to take away as a part of our conversation today?
Yes. So in Ghana, we've partnered with the government of Ghana through the Ministry of Health and the government and the Ghana Health Service to create the world's largest drone delivery network at national scale through a fully integrated system that ensures that there's true last mile delivery being achieved by employing the use of both ground and aerial logistics in a very complementary manner that looks more like a lock and key system. Now, this system optimizes the healthcare supply chain by making it very resilient and making it very robust against some of these issues like pandemics, which we currently are in one. We currently have 4 distribution centers which we operate at an 80-kilometer radius each within rural communities in Ghana. And from these centers, we have distributed more than 155,000 doses of COVID-19 vaccines. And we've also delivered, aside this, 4 million doses of regular immunization vaccines as well. We've been able to successfully do this due to a strong collaboration we have with our key stakeholders within the supply chain space, the expanded program on immunization, who are the main stakeholder in country with respect to vaccine distribution. And because of the general advantages of having aerial logistics implement ground logistics, we've been able to collaborate with EPI in a lot of other ways to make sure this works. The first is that we have dedicated hard to reach areas within the region where ground logistics will not be able to naturally be able to serve. So we collaborate with the expanded program on immunization to make sure that these dedicated hard to reach areas receive their vaccines on demand and they are able to get their COVID-19 vaccines to them directly. By hard to reach areas, we mean islands, we mean mountainous areas, areas that are very difficult to navigate, areas with very bad roads. You even have areas that in a dry season it's a plain land, but in a rainy season you cannot even identify the location. It's completely taken over by water. And some of these areas would have benefited actually from Zipline's drone delivery service. You also have areas that have been flooded due to their terrain, and trucks are not able to go there, and so we collaborate with the state to make sure that those areas that are flooded during the rainy season are able to receive their COVID-19 vaccines as well. We also have areas that are further away from the cities that would have taken a lot of effort to get to. It'll probably take you hours driving with a truck from one point to the other. There's a chance that you even have some of the vaccines going breaking points because of some areas not having very solid road networks, and so we're able to support in that regard as well. You also have facilities that are lacking the requisite cold storage capacity, and so Zipline is able to support in that by working with the expanded program on immunization. And also you have teams that are on the field who at some point will need extra vials to be able to continue with the work that they're doing with respect to vaccination, and they're able to do this by getting it on demand from Zipline as well. Some of the lessons that we've learned have been really great. Technology has evolved, and it's if taken up really strongly, there's a lot of advantages that could really improve the health outcomes of people. Supply chain can really be reimagined to achieve true last mile when 2 or more complementary pieces are put together. And also being open to change also has a lot of gains within the health space, because some of these traditional supply chains have been there for a long time. Adapting to the use of drones is a new thing, and so being open to change is able to bring a lot of gains as well. A lot of cost savings is also in there by using complementary technologies, and also public-private partnership and collaboration has also been very powerful, and that has also helped us be able to achieve this feat.
That's fantastic. Thank you so much for that. Dr. Varghese, I want to get your perspective. We talk about this every single day within AmeriCares as part of the work that we do in terms of medicine security, global supply chain and logistics, and also this idea that it's more than just getting the shots to the communities around the world. It's everything that goes around it. You know, the continued diagnostics and treatment prevention and vaccine confidence, all of those perspectives. So I'd love it if you could share with us from your point of view some of the key points that you see and how we can, as a global community, equitably distribute COVID-19 vaccines.
Yeah, Stephanie, I really echo what Julie and Samuel have already shared in terms of the importance of partnership and innovation in terms of equitably being able to distribute COVID vaccines. I think what Julie said about vaccines does not, equate to vaccinations is so spot on. There are so many steps along the way from getting vaccines into different countries to actually getting those shots in arms. So you think about the health workforce and having sufficient staff to administer vaccines, trained staff to administer vaccines, all of the logistics, that Samuel described. Thinking about health literacy and overall kind of vaccine confidence, when these vaccines reach vulnerable communities. And so there are so many different pieces along that full spectrum to really ensure that the vaccines then equitably do reach the communities that we serve. And so when I think about partnerships, one example is in India. We have a local hospital partner who has the vaccines but needed support with logistics and operations. And so our team in India was able to partner with the local hospital to be able to bring COVID vaccinations to slum communities in Mumbai. And so those partnerships are really so critical to ensure access to some of the harder to reach communities. I would also say, just in terms of advocacy, when I think about national rollout plans for COVID vaccinations, there are still some groups that are not part of those vaccine rollout plans, like migrants, refugees, displaced individuals. And so continuing to elevate the voice of those communities is also really critical, I think, to achieving equitable vaccine distribution within the countries where we're working.
Right, thank you. Samuel, you started to touch on this, and I think it's a perfect opportunity for us to pivot into a conversation around the global supply chain and the challenges that are there. So, with the rapid spread of COVID-19, obviously triggered the shutdowns of companies and industries around the world. And as a result, supply chains are facing huge challenges. And we're seeing how it's all interconnected and easily disrupted in terms of sometimes the fragility, if you will, within global supply chains and the need to look at new technologies and last mile health delivery. So I'd love to get, Samuel, your perspective on how are you and the Zipline organization thinking about resiliency and equity within supply chain? And I think what you're trying to do through your autonomous aircraft delivery and drone delivery is really getting at some of those opportunities. So Samuel, would love to get your thoughts here.
Thank you. And I think COVID-19 has really quickly proven how well connected we all are. The world is indeed not that big. And when something as important as global supply is affected in one part of the world, it definitely has a ripple effect on a lot of things, including healthcare. As mentioned early on, when healthcare supply chain is really like interrupted, the patient is the one that ultimately suffers that unavailability, and the erratic and inconsistent supply and a general sense of medicine insecurity comes up. And we are all connected not only because this world is together, but also because the whole medicine value chain and supply chain is linked together, from the manufacturer's point of view to importers and distributors to the payers, the financiers, the managers of the healthcare supply system, healthcare professionals who are taking care of the patients. And therefore, whenever any of these key members of the supply chain system are affected, it may lead to a disruption of supply, and therefore we need to become resilient globally. And that means that there has to be some kind of robustification of the whole chain in a manner that does not break it. And this can be done by having like more of an integrated system instead of working in silos, right? When it comes to the work that the policymakers have to do, the governments must own their direction of the healthcare supply chains and make sure that certain policies and policy decisions would will be able to set the tone, like we have been able to do and are still doing with the government of Ghana, by integrating drone delivery services in our healthcare supply chain. Without strong policies that lead to strategic supply chain roadmaps, supply chain systems won't improve. When it comes to financing, globally, we need to look at using pooled funds from donors, from governments, bringing all this together. For example, in Ghana, we have what we call a basket fund that is used for contraceptives, vaccines, and other categories of essential medicines. And so the donor groups around the world would definitely be key players in here when, with respect to financing, we go all towards a pooled type of system, and that brings more stability. When it comes to the supply chain, the core supply chain itself, the integration of systems that would allow smooth movement of products to the doorstep of the patients is something that would make the system really robust. Using category specific approaches. For example, in Ghana, we have the HIV program, the TB program, the contraceptives program. These separate category specific programs allows us to put more focus on these programs. It allows us to be able to have in place strong performance metrics that would help us track these specific programs for all the way to the end, which helps us be able to ensure that the patients on these programs are able to benefit. And also the introduction of innovative technologies as ours, and integrating it really is going to be of great support. What Zipline has done in Ghana has been one of not throwing in our system and expecting it to work as a parallel system, but making sure that it works as an integrated system with an already existing system, as a means of optimizing the supply chain system and not running as a parallel system. That is something that will definitely bring in a lot of benefits. I think generally around the world as well, COVID has shown us that health system strengthening is something that is really important, and governments around the world definitely need to put a lot more effort around health system strengthening, capacity building, to make sure that with respect to the whole supply chain, every key stakeholder is well supported.
Thank you so much for that. Now, Julie, on top of your role at Pfizer, you also have a background in supply chain management. So I'd love to get your perspective on how you think we can start thinking through resilience and equity in the supply chain.
Thank you, Stephanie. Right, prior to this role, I worked in Pfizer's commercial supply chain organization, and we operate one of the most sophisticated supply chains probably in industry. But what we don't have visibility to is really that last mile supply chain. This is where we don't have a lot of control, and we truly rely on our partners, partners like Zipline, who is a Pfizer partner, for distribution, and AmeriCares, obviously a great partner as far as health system strengthening and healthcare worker training. These are the areas that kind of take over when our supply chain ends. And I think it's really important for us to have a lot of partners, get the insights from the partners, have them meet our internal supply chain colleagues, and really talk about equity holistically, because we don't understand a lot of those challenges in the last mile supply chain that probably lead to there's probably things that we can do in the last mile supply chain that will help our supply chains in general be more equitable. And I truly think it's these partnerships that help make that connection. And that's actually why I love my job, because I love working with these partners, but then also bringing in the supply chain colleagues that we have at Pfizer, so we can look at the supply chain in its entirety.
Great. So, Dr. Varghese, I have a question for you in terms of the different types of factors that make medicine acceptable or unacceptable. The European Medicines Agency defines acceptability as the overall ability and willingness for a patient to use and caregivers to administer medicines as intended. This includes acceptable medicine dosage, appearance, the form, and many other variables. So, given that, how can we make sure that medicines are acceptable and for different communities and different people? And how do we think about making that process more equitable?
Mm-hmm. That's a great question and a very big topic. I would say, just to start, I would share that there's so many factors that make medicines acceptable. There's the individual and their personal experiences. There's contextual factors around culture or family, all of which impact and kind of affect that acceptability factor. I would say really focusing on local contextualization is so important. Listening to the stakeholders, really understanding what are their specific needs and the challenges that they face, and in thinking about kind of medicines being acceptable. I loved what was shared in the first panel session around the community being the number one partner. And really, when I think about health projects, for AmeriCares, we talk a lot about human-centered design. And that concept, I think, really is so applicable to this broader concept around medicine security and medicine acceptability. So you have to really take into account what are those different factors that would make a medicine familiar or desirable or acceptable for broader use. So one way we do that at AmeriCares is we have really robust review processes and discussions with our partners on every single medicine that we send. They have the final say in terms of the specific medication, the dosages, the quantities, because they really have true insight into what their healthcare workers will find acceptable, what their patients and communities that they serve will then find acceptable. And so I think really tying back to that that patient and community and healthcare worker voice and being driven by those insights instead of what we may think makes a medicine acceptable to the communities where we're working.
That's great. I'm going to toss this one back over to Julie. You all have play such a significant role in the Partnership for Quality Medical Donations, which is known as PQMD. And as we talk about equity and the role of public and private partnerships and NGO partnerships, as you think about equity, and I know that Pfizer has been such a phenomenal partner in this space, why is it so important to donate medicine?
Yeah, thanks for that question. I think in the recent years, there's been such a focus in global health on sustainability, which is incredibly, incredibly important, and it should be the focus. But normally when we talk about sustainability, we normally talk about the fact that medicine should be purchased rather than donated. And I think in most scenarios, that is the case. And including at Pfizer, we are always looking at ways to make our medicines affordable and accessible through our commercial channels. But I do think there are spaces for donations. We've seen this in the COVID pandemic. We see this across the board. There are still communities, there are still countries, there are certain populations where a donation is probably the most efficient way to provide access to medicine. There are refugee populations, there are humanitarian crises, there are the poorest of the poor who under any circumstance would not be able to pay anything for a medicine. I'm thinking about the neglected tropical disease initiatives where donations play an incredibly important role in the elimination of these diseases. And then also working with NGOs like AmeriCares, if there are humanitarian crises or natural disasters where there's a very specific gap that needs to be filled quickly, a lot of times that product donation makes the most sense while a longer term, more sustainable, pathway is established. So we do believe that product donations have a role among a lot of different access strategies. And I think that will continue, even as we move on through the years.
Well, thanks for that. We have one question from the audience that we will take really quickly. Does the concept of medicine security prioritize certain types of medicine? So Dr. Varghese, why don't we start that one over to you?
Sure. I think that's a really good question. In my perspective, I would say we've made a lot of progress in terms of medicine access for infectious diseases. Julie mentioned the neglected tropical diseases and how donations have played such a critical role in terms of broadening access. I think, certainly when I think about medicine security, I think about all different types of medicines and all of those different factors that play a role in medicine security. I really think that chronic disease is a critical area where we need to really focus in on medicine security. So, thinking about the global burden of chronic diseases, the number of deaths, the majority of which are happening in low and middle income countries, I think that we have a long way to go and more work to be done around medicine security, specifically in the area of chronic diseases.
That's great. Well, listen, we've covered a range of topics today, from supply chains to vaccine equity, all in the larger macro conversation of medicine security. To close things out, I'd love to ask each one of you, what elements of medicine security do you think are most urgent, and what gives you most hope for change? So, Samuel, let's start with you.
Yeah. So to me, the equity part of for me is pretty urgent. Where I come from, there's still a lot of gaps in service delivery. I'm sure it's the same across the world as well. These are people who may be in certain geographically disadvantaged locations, in islands, in peninsulas, and also below their poverty line. And there's still a lot that could be done. Even though COVID was a hard thing, was a hard and bad thing to happen to the world, it has exposed a lot of the gaps in our healthcare systems. And I am most hopeful that with all the technological advancements and changes happening in the health system, policymakers would also fall in line quickly to set direction to close some of these gaps, even as we continue to fight off COVID.
Oh, thank you so much for that. And then let's go over to you, Julie. What do you think is most urgent, and what gives you hope around medicine security?
Thank you. Yeah, I have to agree with Samuel. I think the pandemic really exposed the gaps in equity around the world. But that does carry into what's most hopeful is that I think in this virtual world, the the speed at which we've been able to partner and the global health community come together quickly to address some of these challenges, especially looking at new technologies, looking at innovations, looking at new partnerships, has been pretty unprecedented. In the past, we used to have to fly to meetings. We used to really only connect with the organizations that were within our geographical travel distance. But now it's just as easy for me to talk to Samuel as it is for me to talk to Dr. Varghese. So I think that I have truly seen that in this pandemic. The number of new partnerships that have formed is really inspiring, and I think that that gives me hope for the future.
Oh, that's fantastic. Over to you, Dr. Varghese. What do you think is most urgent as we look at medicine security, and what's giving you most hope in the work that you're doing every single day here at AmeriCares?
Mhm. I'm going to continue the theme of the COVID pandemic, I would say, in terms of, what is most urgent in my mind and also gives me the most hope, really focusing on the global vaccine distribution is really so critical. And similarly, I think the pandemic has exposed so many challenges that were pre-existing even prior to the pandemic, but has really helped move some important conversations, and when I think about all of the advancements that we've made as a result of the pandemic, just the tremendous work that Pfizer and other, of our pharma partners have made around vaccine and other therapeutic development, all of the ways that we've leveraged technology for patient care, incorporating telehealth, making it easier for patients, individuals, communities to access medical care. I think that we've really started to lay a foundation for being able to tackle other critical health issues like medicine security in the future.
Great. Thank you so much for that. I want to thank each one of you for taking time today to prioritize this conversation, not only around equitable access to medicine, but health equity in general. We most appreciate it. And we really do appreciate you joining this panel conversation today. I think hopefully for our audience who's attended, there is excitement about the concept of medicine security and the role that all of us have to play in delivering medicine security to every single person around the world. And I'm sure everyone who's attended will be excited to continue to see the work that all of us are doing together.